So hi everyone, this is Dr. Nive Manokaran again exclusively for Femini, and today we will be talking about a very interesting topic without which a whole sexual health topic will be completely irrelevant. So what we're going to deal with today will be STIs, which are sexually transmitted infections, also known as sexually transmitted diseases in the past. So STIs we're going to go for and talk all about STIs today. So they are sexually transmitted infections, which means when you're having a sexual encounter with someone, you get these infections from them. It does not necessarily have to be a penetrative vaginal sex. It can also be oral sex from which you can get STIs from. So when you're a sexually active person and you're having any form of sexual encounter that I've mentioned now, you can be exposed to STIs, and that is something that you need to be aware of, and that's important. Again, coming to women, all of us have discharge, and that's the problem, I should say, because when something abnormal happens, sometimes we fail to recognize that it is an abnormal discharge. We don't tend to worry about it because we have all kind of discharge around our period cycle. So it is hard for us to differentiate what is normal vaginal discharge from abnormal vaginal discharge. The most important part is to pay attention to your discharge, pay attention to your body, and you kind of will know, this is a normal pattern or not a normal pattern. So that is very straightforward. So when you're having a discharge that is either yellowish green in color, if you are extremely itchy down there, and if everything down there looks red and inflamed, and then if you have a discharge that is extremely smelly, mostly like a fishy smell, all of these discharge can be abnormal, and you may have to go and consult with a doctor to see how you can actually fix it. So you don't have to freak out, you don't have to panic. Just go and have a chat with the doctor, maybe do some tests, and it'll be easily fixed. And that is the best way to actually do it, rather than sit on it and try to fix by yourself. Don't Google and find remedies for discharges, because Google is not a doctor and it is not a best way to find what you need to do when you have something abnormal going in your system. So these are some important things that we need to know about our vaginal discharge. You may never know whether you have an STI or not until you go and have a STI test. So that is something that you need to know. People can have no symptoms, they may not have itching, they may not have pain in the abdomen or vagina, they may have absolutely no symptoms to tell them whether they have an STI or not. So if you're someone who's sexually active and not really diligent about using condoms and have had unprotected sex, the best way to know that you have an STI or not is to go and see a doctor and get tested for STIs. So the most commonest STI that is around there is chlamydia. So that is very common. And the second common is probably gonorrhea. Gonorrhea, chlamydia are the two common STIs which can be tested from a urine test. So just pee in a cup and you'll know whether you have one of these things. The second level of STIs are some STIs that can be tested by doing blood tests, which will probably include syphilis, HIV, and hepatitis B. A lot of us are vaccinated for hepatitis B as a child, as a part of our immunization program in India. So you can get a test to see whether you have antibodies or not to that vaccine. And if you don't have it, you can actually get a booster and prevent yourself from getting hepatitis B. More importantly, I have to mention it, are two STIs that you cannot get tested regularly. One is herpes, which is again a very common virus, and the other is warts or HPV. These are viruses that behave exactly like COVID. And so I think it's just made it easier for us to say they can be asymptomatic, you can transfer it from one person to another, you may not know that you have it, and you could still be contagious. What is very important about HPV is the virus that causes cervical changes or cervical cancer. So what is important is all women or everybody with a cervix need to go and get what is called a pap smear, which is done every 2 years, or you have to get a cervical screening test, which is done every 5 years. There are also vaccines available to prevent yourself against cervical cancer. So definitely talk to your gynecologist about these vaccines, which you can actually take to prevent from getting cervical cancers that are caused by HPV. So here is something that you really need to know in terms of other STI infections. Another common infection, which is not an STI, that comes along with sex is your commonest urinary tract infections. It is very common for women to get urinary tract infections after sex. Why? Because your urethra is so tiny. So it's very easy for germs and organisms to actually get into the urethra and give you a urinary tract infection. So if you're having burning while peeing, and if you find yourself going to the bathroom excessive number of times, you probably have a urinary tract infections. Again, go and see a doctor and get yourself checked out and get some medications for urinary tract infection. So I hope you all got a lot of information from today's session, and I hope you're taking away the most important part, saying even if you don't have anything that I spoke about today, but you're sexually active, get yourself STI testing. And if you all want to hear about some other topic, and if you're really interested, please DM us or write us in the comment box, and we will definitely address those topics for you. I'll see you all again. Bye.